Welcome into the Mental Health Hour. Welcome to episode 102 on postpartum depression. This is an episode that has been requested several times, and we are finally getting to it. So I will be probably leaning a bit more heavily on Gemma for this episode as she has a lot to share with postpartum depression. I know what my wife kind of went through. I can't put it into words for her, but I can talk on, from a husband standpoint after the birth of Penelope. But good evening, everyone. It's good to see everybody here. Thanks for joining, and thanks for listening on all the major podcasting networks. If you're listening to the replay, it's good to have you. Gemma, it's good to be back. How was vacation?
Very good. I miss doing the broadcasts. Like I remember when it was Wednesday, and I'm like, I should have been on now. But it was good to have some time away with a friend. We'd been planning coming over for 2 years, but COVID and everything else just kind of fucked that up.
Mm-hmm.
So it finally happened. So it was nice. I got to be a tourist in my own country.
I saw some pictures.
Yeah, we did Buckingham Palace, Westminster Abbey, Tower of London. Threatened to leave Thomas in the Tower of
and and your friend came from
London.
Canada, was it?
Yeah, Ontario, Canada.
Canada. Canada.
Long flight.
Jim says, not sure about the guest you had on last week. Jim and I had a chat during last week's best of TMHH. Yes, last week we had just a replay of an old Haps Days interview with Jim in Chicagoland.
I'll never
That
forget
was
that.
one of my favorite episodes and one of our first interviews
Yeah.
on the show. So, very big shout out to Jim in Chicagoland, uh, and a thank you for him coming on and talking with us. Wouldn't mind catching up at any time. Always welcome back.
Next time he comes back, can we not be doing it while you're working?
Yeah, that would be
Because that was tense.
ideal. We made it through.
Yeah,
No calls were had that
thank
during
God.
that hour. Thank you, and it was a great interview.
Yeah, it
So
was.
anyway, tonight, postpartum depression. We have, like I said, this one's been requested a few times in the Discord, and we've been kicking it around for a while. Um,
Mm,
like I said, I'm gonna have to probably lean more on you for this because you'll have the first hand knowledge.
mm,
So with that, why don't yeah, well, tonight we'll have, like any other good episode of the show, we have some informational slides to go over. I just found a few that seemed decent for the content and kind of global. And then I did find a nice video to kind of go over signs, symptoms, what is postpartum depression or PPD, and how it differs. We can talk also about how it differs from just baby blues, as it's called or referred to. But let's start with Gemma. Uh,
mm.
you want to get into kind of your dealings with it, or whatever you want to start with, like maybe just
Mhm.
how you knew also the difference between what you were experiencing being postpartum depression versus just baby blues, uh,
Mm.
or what have you.
Yeah, so I had it really quite badly when I had Thomas. He is my only child. And at first, I mean, I've heard of baby blues, I'd heard of postpartum depression, but I didn't think that's what I was going through. I thought at first I was just maybe a bit worn out and tired, struggling that way, because I didn't really have the supportive partner or anything, and we'd just moved house. I'd got this house that was an absolute shell at like 7 months old, and we had to try and decorate the whole thing up while I was heavily pregnant, struggling to walk. My own disability was causing me problems anyway, so I just thought I was tired all the time. But then things started getting worse, where there was times where when I look back now, I still feel terrible about it, but I also know that it wasn't me as a parent that was behaving in that way. It was the depression that had got hold of me. But there was times where I could have just thought, like when Thomas was crying and things, "Leave me alone. Why are you crying? What do you want? You've got everything." And I just wanted to walk away and leave him. Like I couldn't deal with it. And it got to the point where I had to get my mum to help me because I was really, really struggling with it.
Mm-hmm.
And when he would cry on a night and things, and I'd be there like putting the pillows over my head, like, "Stop, why won't you stop? You don't need anything." And it's not until I went for one of his regular, I think it was just like a weigh-in thing that they did, and the doctor said that I looked really, really tired, and I happened to mention something, um, because I'd not been eating or anything, not been looking after myself at all, and they said, "We think you're suffering with depression."
Mm-hmm.
I went and spoke to somebody else, and they said it was postpartum depression, and I had to go on a course of medication and had more regular visits from the midwife and things just to see how I was going. Because of my condition, um, when Thomas was born, I I had to have an extra epidural for the fact that I could still feel that they were cutting me open,
Hmm.
and it caused me to have a bit of a seizure on the table, so I couldn't have the immediate contact with him that they would normally give you. He was around 2 hours old when I got to actually hold him.
So, what Gemma was getting into there was quite a bit of the depression itself, not solely postpartum depression, because I know with me having diagnosed depression as well, I've felt several of those markers that she was touching on.
Mm,
Uh, you know, not necessarily obviously postpartum depression, but just depression in general. So I guess that's how you kind of came to the consensus, I guess, with your doctor that there was
mhm.
postpartum depression going on because you were displaying all of the signs of regular depression.
Yeah, yeah, I'd had regular depression for a long time anyway because of all the things I'd had, but
It just amplified with uh,
yeah, yeah,
the birth, I guess.
because a lot of it, like, I felt really bad, because of the fact that I couldn't breastfeed my child. Like, I'm thinking, am I doing something wrong? Is it something I've done that means that he can't feed? Because he had to have an NG tube. Ended up in intensive care, which meant I got to spend less and less time with him.
Hmm.
So when I finally did get that time with him, I kind of felt disconnected. Like, I knew that he was my child. I knew
Yeah.
I'd given birth to him, but that bond that was like I saw with every other parent, because I was in hospital for a while with him, it, it felt more of a struggle for me to get. And I then started thinking there was something wrong with me and then wrong with my baby. And then yeah, like I really had to be encouraged to do things,
Right.
and to look after myself at the same time. And then when they mention depression, I'm like, well, I have depression anyway. What's different? Why is this different? And
I
it took
think
me a while to accept.
I think it probably becomes, and correct me if I'm wrong. And hello to Nonsensical Nonsense Podcast. Everybody, say hello to our good friends over at the Nonsensical Nonsense Podcast. Streaming live on Twitch Mondays, Wednesdays, and Saturdays around 7 p.m. Eastern Standard Time. Give them a follow. Great group of guys. Um, but correct me if I'm wrong, Gemma. The depression you mentioned, how do you know it's separate from, because you had diagnosed depression? Did you
Mhm.
feel, and I guess in talking with my wife and such, was there ever any resentment towards Thomas? Like, did you feel like you resented him, or for
Oh, yeah.
maybe for what the constant 9 months of quote unquote damage to your body,
Oh,
uh,
yeah.
or um, you know, not latching, which is something that a lot of mothers go through. I
Mhm.
know it. I know it feels quite lonely, probably when you're going through that. Like, why is my kid not? Everybody else has no problem
Oh,
with
yeah.
latching and stuff, but it's very quite common.
Mhm.
Penelope had trouble latching as well, but she still found other avenues to eat. Like, she wasn't starving, but she just didn't get that latching thing down uh,
Mhm.
right away. So I know that there's a lot of similarities between most new mothers, that could cause maybe some resentment. Do you think that factored in?
Oh, yeah, definitely. I was definitely comparing myself to the other mothers on the ward, and I'm like, well, they're feeding fine. Why am I not feeding fine? Is there something wrong with my baby? Is there something wrong with me? What's going on? And then the fact that I'd had a cesarean and cut from literally hip to hip, and then they expected me to get up and walk like hours later and stuff, and I was just in agony. I didn't want to do anything.
Yeah.
And I'm like, why, what the hell? Where's my body gone? Why am I? I'm like, I've just dropped this 9 pound baby and I've lost no weight. What the hell?
Yes,
Um,
and for somebody that struggles already with body dysmorphia,
yeah.
which a good bit of the population does, it
Hmm.
does take a toll on that aspect of things too.
Oh yeah, and for the longest time, seeing that scar right across, and I'm like, because I've since lost a lot of weight, and they effectively cut through your muscles, which makes it dead tissue, and when you lose that weight, there's fat there that you can no longer lose. It needs to be removed. And it did make me think lots of things at the time about, is it worth it? Why did I do it? Why have I got a child? I'm not seeing any of my friends anymore. I can't go out. I'm too tired. Why is everyone else's baby behaving out and mine screaming absolute blue murder all the time? What is it wrong with him? Why? What does he want? I'm like, he's got a clean nappy, he's eaten. What the hell does he want? Why does he keep screaming all the time?
Yeah.
And it was just to the point where like, yeah, I just wanted to be like, I can't deal with this anymore.
So
And I felt so bad.
you definitely felt that debilitating feeling that only depression, severe depression, can manufacture, in just not wanting to do anything, not wanting to get out
Mm.
of bed, not wanting to
Oh yeah, I
shower
just wanted
even.
to be left alone, like, and I did. I had to really be forced to get up, to shower, to eat. I just didn't want to do anything anymore. Like, I'm like, I have carried this child around in my stomach for 9 plus months, and now you're expecting me to do all this shit as well? Like, what? And then I certainly think a lot of it had, like, because I was doing it all on my own pretty much. I mean, there was a other person here at the time, but he might as well not have been. And then that made our relationship at the time very difficult. And he struggled to accept that now there was someone else here, a baby, and I was looking after the baby all the time, and I was too tired for anything with us. And that changed the relationship, and it got very volatile then.
Right.
And as I've discussed before, abusive. And I ended up being literally held prisoner in my own home for quite some time. And that was another thing that I thought, like, is this the like because he doesn't think I can cope with the baby? Why has everything changed? And it did. Everything seemed
Again, you
fine.
sort of pointing the finger at yourself, and the
Yeah.
spiral continues.
Oh
Uh,
God, yeah, it was
yeah.
terrible.
We are talking postpartum depression this evening, something that a very, very large amount of women deal with, whether it be minor all the way to severe. So, Gemma has been nice enough to share her experience after the birth of Thomas. We're getting into a little bit about resentments and what causes the depression to spiral somewhat out of control after the baby has come and is born. Um, I did see my wife take a bit of a turn after Penelope was born. She did not have, and I don't want to put words in her mouth. Like she might have a completely different aspect. Unfortunately, she's at work, so I can't bring her on right now. But she did have, kind of the baby blues. Uh, it wasn't just like debilitating, but you could see that the change in the air, the aura was there. Um, I know having trouble getting the latching, like we were talking about, was bothersome. But overall, I think she and Penelope bonded right away.
Mm,
They did the skin to skin as soon as Penelope was born. And another thing, kind of a little off topic, but not so much. Uh, we I don't know how much this plays in, and maybe you can speak to it, Gemma. I've been talking with some folks recently who, some of our friends are pregnant and they've had kids in the past as well. Um, in particular, some folks choose not to find out the sex of the baby until they're born.
mm.
Be surprised.
I was one of them. I didn't.
So good, you can speak on this. Do you think that that plays into the bonding in a sense of if you choose to know the sex when the
Mm,
baby when the baby at the ultrasounds and everything, you want to know right away, that's great.
mhm,
And then you can start, okay, it's a girl. We can start picking names, we can start painting bedrooms and getting cribs and planning around a baby girl, knowing that it's coming. And then on the other side of that coin, in talking with some friends that did not find out the sex, I've heard probably some more of the not so easily bonding because you haven't had that time in the preparation. You don't know what it is. So if it
mm,
comes out a boy, it's like a stranger. Whereas folks that choose to know the sex or spend the next 6 months planning around a baby girl or a baby boy, and it's not
mm.
so much a stranger. It's a nice surprise, yeah, right. But do you see what I'm saying? Like,
Yeah,
is there
yeah,
a certain benefit of bonding in that 6 months, knowing that it's coming and it's going to be a girl versus surprise? Here's a boy that
yeah.
you haven't prepared for at all. What do you think about that?
Yeah, I definitely can see. That because I know when I was preparing for a baby, I just knew I was going to have a baby. So
Hmm.
everything was white and yellow because I didn't know which one it was. And I did want to keep it like that, but there was a sneaky part of me like, what if it's a boy? What if it's a girl? What do I want more of? And I feel to a degree there was parts of me that was like in my mind wishing it was a particular gender. Um but not knowing. And then obviously the plan was that when the baby was born, the dad at the time, obviously things are difficult now, would give me the baby and it would be like it's a boy or it's a girl. So I picked out two names, like
Hmm.
Thomas for a boy, and if it was going to be a girl it would have been Jessica.
Hmm.
And I had to plan for both outcomes, so it was kind of exhausting doing that, not knowing, and having to be super careful not to get anything blue or pink.
Right. Got
But
to
yeah,
stay
I had
neutral, essentially.
absolutely no idea what I was going to be landed with.
Right.
And then when I was given a boy, I was thinking, like, now would I have preferred a girl? Would I have? And I didn't know. Like, and then because I was also told I was high risk for giving birth to a Down syndrome baby. They
Hmm.
gave me a 1 in 31 chance. And they offered me an amniocentesis test, but said it was very high risk anyway. And with my complications, it would be even higher risk.
Right.
So not only did I not know the gender, I chose not to have that test because I didn't want to risk the pregnancy because I was told I couldn't get pregnant anyway.
Right.
And I'd had a miscarriage prior to Thomas. So I was already very wary about having that again happen to me and lose another baby.
Hmm.
But to
That.
then think, not only do I not know the gender, but I also don't know if he's going to have something wrong or if there's Down syndrome. And I went through the first two trimesters being told he was underweight to then give birth to a 9 pound 12 huge baby. And like that's what I mean. They underestimated his size, and I was having a cesarean, an emergency C-section, because I'd been induced. I called it eviction day, just
Eviction day.
different. Yeah, and they were kept saying me, you're not in labor, you're not dilating, and I'm like, I am in fucking labor. This fucking hurts. Get him
Yeah.
out of me. 4 days in labor, and they're like, oh yeah, your cervix ain't working. So by then he'd got the cord round his neck. My heart rate had dropped massively, and my blood pressure. Thomas's heart rate was fast as anything, so they had to rush me in and do an emergency section.
Yeah.
Then they had to cut me, and I'm like saying, I can feel you're using scissors. Why can I feel that? And he was like, you shouldn't feel it. I said, well, obviously I can because I can't fucking see it. And I'm shouting at everyone, like, because I felt it. And then they went and put some more in, and I had this seizure, which didn't help. And
Hmm.
then he cried before they took him out of me. So I automatically assumed there was something wrong then.
Sure.
What's wrong? And then he went dead quiet for a while, and I'm like, why's he stopped?
So there's
In
just an incredible adrenaline dump
Yeah.
happening. Uh,
And he was
all
out
this
maybe
adrenaline
a good
building.
5 minutes before I even knew what he was. I'm like, what is it? Is it a boy? Is it a girl? Like, I didn't even know. I'm like, can you tell me what I've just had? And yeah,
Yeah.
it was so massively overwhelming. Everything seemed so rushed. And I think because of the way things were done, I didn't get that bonding time with him that
Yes.
some do. And then I spent the whole time on a ward where everybody else had their babies, but
Yep.
mine was in intensive care.
Yeah.
So I
That's
was on my own, having had a baby but not having one at the side of me.
that definitely has to
Everybody
add
else
to the
carry on.
that definitely has to add
Yeah.
to the depression. But then forward or fast forward into coming home and having a couple of months under your belt, postpartum depression is striking not just, immediately after the birth of a child. Like there's cases of it maybe even as much as a year after.
Yeah, they said that I think mine hadn't cleared till he was nearly 18 months.
Mm-hmm.
They were still treating me while he was 18 months because there were other things like where he was fed via an NG tube for a while when he
Right.
was born. Then he couldn't eat anything solid till he was about 18 months. And I'm just constantly thinking, why are things going wrong for me? What's wrong with him? And I'm thinking, is it me that's doing something wrong? Is it him? Is there something wrong with him? And then because I had this worry of him having Down syndrome, before he was born, and then I'm thinking, well, how did they know that? What made them think that he was high risk for it? Is it something else that they've picked up on? And it gets your mind thinking into other avenues. Okay, it's not Down syndrome, but what is it? What did they find to make them believe that? And I did start thinking there was things wrong with him, and constantly wanting to go to the doctors, get him checked, because he did have a bit of jaundice and things when he was born,
Sure.
and not latching, not being able to feed him. I ended up with mastitis, could only produce from one side. And I'm just like, my body's not working. Why can't I do the one thing that a mother's meant to be able to do, and that's feed your own baby? And I
Yeah,
couldn't
and
do
that can
it.
take a toll on anyone.
And it just absolutely snowballed out of control. And it wasn't until he was about 18 months old where I could finally come off the medication. And they put me back onto a different one. I mean, I had to come off a lot of my medication anyway when I was pregnant because I was pregnant. And as I
Ella
say,
says, Ella says, I think I have postpartum after 20 years, still postpartum, right?
oh God, yeah, he turns 10 next month, and sometimes I'm like, good God. Yeah.
Let's take a look at let's do the video first.
Hmm.
Um, and then we'll come back and look at some slides to kind of round out some of this information. Um, and then, as always, we can look at a slide I have on coping with postpartum depression, and we'll talk again with Gemma about what she has done. Other than she said she was in treatment for it, but we'll take a look at maybe some things that she had gone through or done to remedy. But first, let's take a look at this video.
Hmm.
It's about 5 minutes long, so it just goes over some signs and symptoms and what we're looking at here. So we'll be right back after the video is over.
Hey y'all, welcome back. I'm Mama Dr. Jones, a board certified OBGYN, a mom to 4, and today we're talking about postpartum depression. I just finished up doing an interview with Ned and Ariel Fulmer of the Try Guys and the Try Wives and the podcast Baby Steps, which is where they'll be broadcasting our discussion. It was all about postpartum depression and postpartum anxiety, and it was such a great conversation that I just wanted to hop on here and talk a little bit about these topics with you all. Postpartum depression is something that is relatively common. About 1 in 10 will experience this after giving birth. And that's why it's so incredibly important that we bring awareness to the issue. What exactly is postpartum depression? Postpartum depression is a series of several different symptoms, anything from just feeling uninterested to having excess guilt, or even changes in your sleep habits or changes in your appetite. And these have to go on for a period of at least 2 weeks. To be postpartum depression, it has to occur during the 12 months after delivery, but there's also a perinatal depression which can occur during pregnancy. And I think it's really important that we highlight that, and we'll talk a little bit more about it in just a minute. What's the difference between postpartum depression and baby blues? You've all heard about baby blues, and we've all been told like it's kind of a normal thing. And baby blues is super common. This is something that happens in almost everybody to some extent after they deliver. It's kind of an onset of crying and mood lability and just not feeling quite right, or sadness that happens about 2 days after delivery, sometimes 3. But of note, baby blues should end at the 2-week mark. If you have ongoing symptoms after that, or if your symptoms are severe and interfering with your daily life, your ability to take care of and bond with baby, this is very important for your doctor to know. Postpartum anxiety is really similar to postpartum depression and has kind of the same diagnostic criteria, with the 2 weeks and being present most of the day, interfering with your ability to do normal day-to-day life. But the overwhelming feelings there are anxiety and worry instead of the depression symptoms. These can coexist, they overlap, there's kind of a gray area in between, and so it's important that we talk about both of them. They're both treated pretty similarly. The best treatment for postpartum depression and postpartum anxiety is going to be therapy. Sometimes we need to mix that with a medication, and we can find a medication that is safe for pregnancy or breastfeeding. So when should you bring it up with your doctor or advanced practice provider? Most of us should be doing an Edinburgh Depression Scale or some form of depression anxiety screening at your postpartum visits. For me personally, my kid's pediatrician would always give me a depression scale to fill out at every newborn visit. And I thought this was such a great idea, because you always see the pediatrician more than the doctor who delivered your baby or the midwife who delivered your baby. And don't get me started on that. We need a different formulation of postpartum care in this country, with nurses or midwives who can come to your home and see you, or at least get you in for a visit more frequently. But beside that, since we don't have that now, while we're working towards improved postpartum care for people in this country, at the very minimum, I think this is a great idea to be screening for depression at the pediatrician visits. Our doctor would just send that over, so she would take care of some of my patients, and when she would find a positive depression screen, she would send it over. We would contact the patient and get them in for a visit or get them set up with a therapist. I think it's really important to have an open line of conversation with your partner. And if you are the partner in the relationship, if you notice something that's just not right, you don't think that, everything seems to be going normally, they seem to be feeling guilty or not able to take care of the baby or take care of themselves like they should be, you know your partner pretty well. And I want you to feel comfortable bringing this up with your partner or with their doctor, because sometimes when you have postpartum depression or anxiety, you don't always have great insight into that. Some people do. Some people know something's not right and they need to get it taken care of, or at least bring it up and talk about it. And other people just don't understand that it's not just normal adjustment to having a baby. Although it's really difficult to talk about, suicide is one of the #1 killers in the postpartum period. And I think this is important to bring up because it's something that we can prevent with the right measures. So any thoughts of harming yourself, harming the baby, any plans to do any of those things, this is an emergency and a reason to call 911 or go to the emergency room. Don't wait until your next visit. Don't wait until normal office hours. You need to be seen immediately. I also think it's really important for us to normalize bringing up these feelings. If you've been having feelings like that or thoughts like that and they're intrusive, talk to your doctor about it. I know a lot of people feel uncomfortable because it has been made out to be this shaming part of society, but it's not shameful. Nobody wants this to happen, and it certainly does not mean you're a bad parent. So I want everybody to feel comfortable talking about this and seeking help. How long does postpartum depression last? Postpartum depression can last for a while in some people. If someone is doing therapy and medications, in my clinic, I generally have them do that for at least 6 months, and then we can trial a period off of the medication, and I leave the cessation of therapy up to their therapist. For the medication, we can do a trial off for a while and see how you do at 6 months if you feel like that's what you want to do, but sometimes people want to continue it for a little bit longer. About 50% of people who are diagnosed with postpartum depression or anxiety will have symptoms for at least least a year. And so I think it's always okay to continue your treatment for that year and see where you are. At that point, we can reevaluate. Some people would like to stay on the medication, they feel good on it, they're stable on it, and other people would like to have a trial off of it, and that's totally fine too. I do want to highlight that medication isn't required for everybody who has postpartum depression or anxiety, and a lot of times therapy will be sufficient. I definitely love to take advantage of any referrals that I can. Any of my friends in psychology, psychiatry, mental health of any kind, I would love for all of my patients to have access to that. That's not always practical, but it would be in an ideal world. And I think that the value of mental health professionals cannot be overstated. These people are wonderful and they're so great, especially for things like postpartum depression and anxiety. The most important thing I want you to know about this is that it doesn't reflect on your ability to be a parent. It doesn't mean that you're a bad parent, even if you're having intrusive thoughts or problems with taking care of your baby. It just means you might need a little help to get better so that you can be the best parent that you want to be. At the end of the day, the most important thing in this conversation is to know that postpartum depression and anxiety is not caused by anything that you did. It just happens. People who've had a history of depression or anxiety are at an increased risk. People who have really complicated pregnancies or traumatic deliveries are at an increased risk. These things are risk factors, but that doesn't mean those are the only people who get postpartum depression and anxiety. Anybody can have this, and in nobody is it a reflection of anything that you've done or something you could have done better. It's just something that happens. So I want to normalize bringing this up, having the conversations, and talking it out with your doctor.
All right. Just a good little video of exactly what postpartum depression can look like. Postpartum depression can look like. There's a lot of different factors that go into it, and Gemma touched on quite a few of those already. Everything from the environment to the status of your mental health heading into it, and then of course all the things factoring in to the home life, heading back into the environment. So with that being said, we'll switch over to some slides for now. And Gemma, if you don't mind taking us through, and we will start with the difference between baby blues versus postpartum depression. And Gemma, I think you're muted.
Yeah, there we go. Yeah, so baby blues, the signs for that are things like weepiness, crying for no apparent reason, feeling like I'm not myself or this isn't me, impatience, irritability, restlessness, anxiety, sadness, mood changes, and poor concentration. And then postpartum depression is difficulty sleeping, insomnia and exhaustion, lack of energy, low sex drive, changes in appetite, weight loss or weight gain, weepiness, excessive worry, agitation and anxiety, feelings of inadequacy, hopelessness, despair, guilt, sadness, fear of being alone, irritability, difficulty concentrating, panic, anger, and scary thoughts about the baby's health, like usually the health and the over concern for the baby's health. Something's bad's going to happen, things like that. I definitely had all that.
Absolutely. And you can see on the depression side, the postpartum depression side of things, it does hit on those markers of regular depression at a pretty severe level when you're getting into the low sex drive, you're getting into the difficulty concentrating, the inadequacy. Whereas baby blues, we're just looking at some mild symptoms, it appears. General anxiety, some restlessness, just feeling not yourself. maybe poor concentration versus the lack of concentration and difficulty concentrating. Um, and then moving on here to some more signs of postpartum depression.
Yeah, so postpartum depression is nothing to be ashamed of. It affects about 1 in 7 new mums and apparently does not mean you're failing, and absolutely, sorry, does not mean you are failing as a parent. And there are several options to treat it. The first step is recognizing the signs of PPD. Even if you have one or two of these symptoms, call your doctor to discuss. You can speak to your midwife as well, they will refer you. So you feel empty and alone despite just having had a new baby to your life. You feel completely overwhelmed as though you'll never be a good mom, and that's totally not true. You feel no bond or connection to this new life you helped create. You're constantly irritated or angry, and you have zero patience. You may even resent your baby because of how your life has changed. You're uncontrollably sad and can't stop crying or shake off feelings of sadness. And you feel out of focus and can't concentrate on anything, least of all your newborn. And finally, you have thoughts of harming yourself or baby. These feelings should never be ignored and warrant to call your doctor right away. And
Yeah,
then,
that's definitely one thing we haven't really discussed yet is that it can present in such a severe way that your people have done harm to themselves or their babies, and these feelings present themselves, and they should not be ignored. Um, that that you have to get out there and talk to a licensed professional, let them know what's going on, just as if uh, it was any other feelings of um, either suicidal ideation or severe depression, without another life on the table
mm,
at the time. We're just dealing when you're just dealing with yourself, you would do the same thing. So now we have two lives uh, to consider, and it
mm,
definitely needs to be taken seriously and um, reach out for help from a licensed professional. But again, with these signs of postpartum depression, you're seeing a lot more of the severe um, side of things. There's instead of just not feeling yourself, you feel completely out of it. You feel like there is zero bond or connection, um, emptiness, uh, uncontrollably sad. Uh, just these things that are you can definitely see the difference between
mm.
what some baby blues might be versus postpartum depression. Um, but let's take a look at the next slide, some statistics for you.
Okay, so up to 1 in 5 women will suffer from a maternal mental health disorder like postpartum depression. Less than 15% of women receive treatment. 1 in 7 will experience depression during pregnancy. Up to 50% of women living in poverty will suffer from maternal mental health disorders. Not just moms, so maternal mental health disorders impact the whole family, not just women. More than 600,000 women will suffer from a maternal mental health disorder in the US every year. Anxiety and depression have risen 37% in teenage girls. This will increase the number of women suffering postpartum depression in the future. And rates of depression are more than doubled in Black moms due to cumulative effects of stress called weathering.
So there's some statistics on postpartum depression. One of the interesting things to remember is that it is not just moms. The maternal mental health uh, disorder impacts the whole family. So that is definitely important to remember. While mom is going through this, the the output on the rest of the family, the baby, etc., is also felt. There's a ripple effect, and that's why it's so important to address it and seek help if it's at a point where it's out of control or it's controlling you, I guess I should say.
Hmm.
But you can see quite clearly that there's no reason to feel alone in this. Uh, many women go through the postpartum depression. The severity of it will always differ from one person to another, but it is good to see that you're not alone. Just like with any other mental health issue we talk about, uh, it's there's something to be said about being able to feel compassion from someone else that might
Mm.
be going through it as well. You don't feel that loneliness. You can see by the numbers here alone, which is why we wanted to put this up there, that it happens quite frequently, and it's nothing to be ashamed of, and it's
Yeah.
most certainly something to address more.
And that's part of the treatment as well, because certainly myself, they like to refer you to like mums and baby groups and things,
Mm-hmm.
and especially groups for those who are going through postnatal, postpartum depression, so that you can see that you're not alone and that you can discuss things with other people who
Absolutely.
who are going through it and get help that way.
Support
Because
groups or group
yeah,
therapy is not everybody's cup of tea, and I understand that. I was never a huge fan of the idea of it until I actually did it,
mm,
and it is just something you can't explain. I've said it on here before. It's just a feeling you can't replicate when you're unleashing some inner demons, if you will, or talking about what's going on in your life, feeling so alone, but then look up and there's a room full of people nodding in agreement with
yeah,
what you're saying, like they know exactly what you're talking about. There's that feeling cannot be replicated.
to have
Until you
someone else validate your feelings and state that they're going through the same thing and that you're not going out of your mind is huge.
Mhm.
And I think that of all the group treatments and things that I've had, and I've had quite a few for different reasons, the one that I went through for postnatal depression was certainly the most helpful, because not only did it allow me to see that this was happening, this was real, and it's not an uncommon thing,
Mhm.
but it also allowed me to make connections with other people who have just had children and allow me to meet friends through that.
Right.
And some of those people I met during those group therapies are still friends today. And
Mhm.
that's huge. That's a really big thing, because not only did I have someone, but it allowed me to have someone from my child as well. And Thomas has got a couple of friends who I went to those groups with.
Mhm.
And it is, I think, certainly one of the most helpful groups
Yeah.
and group therapies that I went to. And I was not interested at all at first. And I really literally had to be forced to go. But when I did start going and I had all these feelings inside of me validated by other people who
Mhm.
I didn't know from Adam, like, and I'm thinking, wow, this is normal then. This
There's
other
no
people are
doubt about it. There's no doubt about it. There's lifelong friendships to be made
going.
in some of these support groups or
And
just group
having
therapies.
someone that just gets it without having to explain, they just get it. That's amazing to have that,
Yeah.
because you don't have to explain everything and they just know how you feel. A lot of my deepest connections with friends are those that I have met through support groups, through internet support groups,
Yep.
and who have very similar conditions because they just get it. I don't have to tell them, oh, I can't go out today because I don't feel like it. And I don't have to hide how I'm feeling
It's
because
neat.
chances are they know exactly how I'm feeling anyway because they've been there themselves.
And keeping on that treatment thing, let's hit the last slide here. 6 tips to cope.
So, yeah, 6 tips to cope with postnatal depression. Number 1, build a secure attachment with your baby, and there is plenty of support out there. You can get extra midwife support and things. Number 2, take care of yourself. If you're not taking care of yourself, you can't take care of another person. Number 3, lean on others for support. Tip 4, maintain a healthy diet. Tip 5, get some rest. I know that's really difficult when you've got a new baby.
Sure.
I had to learn to rest and to sleep when he was sleeping,
Yep.
and it totally screwed my sleep pattern for quite some time. But you need to be rested, and the best way to do that is to rest when the baby's resting. It
Exactly.
doesn't last forever where they're just catnapping and stuff, and then you get to the stage where I am now, and he doesn't ever frigging sleep, it seems. But anyway, and then tip 6, exercise. Even if it's just taking your baby for a walk around the street, take them to the
Yep.
park, anything, just get out and about, do stuff.
And there you have the only one we're missing is journaling. But we tip 4, 5, and 6, they're pretty generic.
Yeah,
They come up quite a bit. Get some rest, exercise, maintain a healthy diet. These are not
journaling.
just on there. They're not on a tips to cope slide for everything we discuss because they look good or because they need space filler. It actually works, and
Yeah,
it's proven, scientifically proven. Maintaining a healthy diet, resting, getting out of that sleep debt, and doing some sort of exercise increases dopamine and endorphins and everything, and it does do something for you. There's
mm,
definite benefits to it. Building a secure attachment with your baby, that might take some work, and as Gemma was alluding to, there's extra support out there, extra midwifing, extra nursing, um, that you can call on. There are resources available to help with that journey if it's not as easy for some,
mhm,
because and there's those resources are in place because this has been an issue for people for a long time. So that again plays into the fact that there's no loneliness here in what you're feeling. This has been around, this is known about, and this is something that now there are resources available for these types of issues, um, and that's thanks to people going through it and talking about it and offering what they do to try and feel better. Gemma, did you hit on any of those things in your story there?
yeah, when you mentioned journaling, that's something I did. Certainly for the very first year leading up to having the baby, and then for the first year, I made a journal. Um, One that when Thomas is older, he will be able to read. I wrote all the things we did, things about like feeding anything and everything. Some of it was to help me and so that I could give the midwives the information and things like that. But it also helps you to form that connection. There is also an app you can get. It's a free app on Android and iOS. Baby Connect, it's called, and you can have the whole family log into this one account, and you can journal that way, so that if, say, for example, you have family that you want to see what's going on but don't live with you, you can upload like their feeds, any nappy changes, photos, any first things like milestones, and it's a really good app. And I used that with my family so that not only was it a reminder to me what I've done, what he's had, and everything else, but the other family members that weren't around could see it as well. And they could see that I was doing these things, and it would show you who's done it, who's logged it. It's actually a really good app. It doesn't have to end when they're like so old. It goes on for ages. I could still use it now if I wanted.
Sure.
I mean, it becomes less appropriate for an older child, but it's still very much a usable thing. But yeah, definitely one thing that's not on there really, although the leaning on others
Mhm.
maybe would be in there, but the support groups and things don't.
Yeah, that's kind of what that's touching. Leaning on others.
Yeah, and
is-
yeah, if you have a supportive family, supportive partner, things like that, that always helps as well.
Yes, indeed.
Yeah.
Well, awesome. Thank you for sharing your trials and tribulations as always. And I don't have a whole lot to bring to the table from the postpartum side of things.
Hmm.
But I think all in all, we got a good episode of information out of it. And it was good to be back, back live after 2 week hiatus. We will be back again next week. I'll be putting together a schedule of upcoming shows here for the Discord. So please join the Discord if you want to keep up to date on everything TMHH. Let's get into some community calendar tonight, or hopefully tonight. Catalyst with Jim in Chicagoland every Wednesday night, 11 p.m. Eastern Time, right here on Twitch. Unwind, relax with a warm candle and a welcoming audience. There's Jim's handle in the chat, Jim in Chicagoland. Give him a follow. Also, check out A Ray of Sunshine on Twitch. You can give him a follow here on Twitch, and you can, for now, find his YouTube through there because I know he's doing a lot with YouTube at this moment, and we'll get that updated on our end as well to make it easier to find those positive vibes and positive stories from A Ray of Sunshine. Next up, please join Eric J. Gaming every Monday night, 7 p.m. Eastern on his Twitch channel. He's a former guest of the show and a great gamer on the channel. And Jim is doing Catalyst tonight at 11 p.m. Eastern, featuring the fires of Maui. Yes, that was very devastating, very sad. So I will be there for that. Gemma, my co-host and partner in crime here on the Mental Health Hour, has her own channel, twitch.tv/GemmaH83. Please give her a follow for all of the cooking, baking, crafts, arts, and everything in between. And finally, for all things bunny, check out our great sponsor, Ella the Bunny Mom. She's here tonight. Check her out. Give her a follow. She streams late nights here on Twitch, plays ukulele, guitar, piano, everything, all with Puppy Cat, her rabbit friend. Also, please join us or check out her shop, www.mybunnyvalentine.com. Use the promo code FireDude15 for all of your purchases to help her help the bunnies. And don't forget to join our community in Discord. The invite link is always available on our bio link and everything in between. So please follow us, share us out, help us grow, help us keep growing. 102 episodes in the books, and that's all thanks to you guys. I got to get out of here. I've got to go feed a baby, speaking of babies. And we will catch everybody next week. Like I said, check the Discord for upcoming broadcasts as we're back from vacation.
Yes.
That's it for me. Bye now.
Bye.